Okay, let's jump into this stack of sources you've sent us, all about two compounds you might be hearing more and more about, DMSO and MSM.
Right. Dimethyl sulfoxide and methylsulfonylmethane. They've gained a bit of a reputation, sometimes even called miracle cures.
Miracle cures, wow.
Yeah, claims they can help with everything from pain and inflammation to joint problems and, well, even some pretty serious conditions.
And our mission today is to really unpack this information in the material you've provided. We're going to try and figure out what DMSO and MSM actually are according to these sources, how they're described as working, what the evidence in this material actually supports for their uses, and crucially, what the documented risks and limitations are.
Sounds good. Let's dive in and see what these sources reveal.
So let's start at the beginning, maybe pull back the curtain on what these compounds actually are. First up, DMSO. What do these sources tell you about it?
Dimethyl sulfoxide. Okay, so the material describes it as a colorless, odorless liquid when it's at room temperature.
And where does it come from? Is it something, natural or synthetic?
Primarily, it's a byproduct of wood pulp production. It's also widely used as a solvent in the chemical and pharmaceutical industries.
A solvent?
Yeah, the sources mentioned it's a specific type of solvent and a product one, which gives it some unique properties. But I think for our purposes, the key thing is its role in industrial processes and as a solvent.
Okay, so a kind of industrial origin. But its most famous property, based on this information anyway, seems to be how it interacts with our bodies.
Absolutely.
Yeah.
Its most notable property highlighted in the sources is its ability to penetrate tissues. It interacts with the fatty molecules, the lipids, in cell membranes.
Right.
And it sort of disrupts their structure just enough to make it easier for other substances to get absorbed through the skin or a mucous membrane.
Ah, so it's like a delivery truck, kind of helping other compounds get into the body more easily. The sources gave some clear examples of this.
They did. One example cited is its use combined with 5-fluorosil. Now, 5-FU, that's a chemotherapy drug, mainly used for serious cancers like colon or breast.
Okay.
But in a much lower dose, it's used topically for things like warts. The sources noted that when combined with DMSO in a topical form, studies showed it was more effective for treating warts than using 5-FU alone. The DMSO helps the drug get into the wart tissue.
That makes perfect sense, helping the medication actually reach the target area on the skin. What other penetrative examples did you see?
Another one is combining it with heparin in gels. Heparin is a blood thinner, right?
Yeah.
Often used topically to help break down bruises or hematomas. Products like the Dolabine Sport Gel mentioned in the source use DMSO to help the heparin get into the underlying tissue faster when you apply it to blunt injuries or hematomas.
So it speeds up healing?
Yeah, helps them heal faster because the heparin reduces blood clotting and can start dissolving the clotted blood more quickly.
Okay, so its role as a carrier is well documented in the sources for topical applications. But the material also says DMSO has its own effects, right? Independent of carrying other things.
Yes, that's where it gets really interesting. The sources list several pharmacological actions for DMSO itself. It's described as anti-inflammatory or anti-phlogistic, an antioxidant, pain-relieving. It promotes wound healing, and even has some antimicrobial effects, a bit like propolis.
How does one compound do all that? What's the mechanism the sources describe?
Well, a major mechanism highlighted is that it's a sulfur donor. It provides sulfur atoms, which are absolutely essential building blocks for various components in our cells.
Like what?
Like key amino acids, cysteine, methionine, and taurine are specifically mentioned, and the enzymes and proteins they form. Many of these are crucial for the body's natural antioxidant defense systems. So by providing sulfur, DMSO basically helps boost the body's overall ability to combat oxidative stress.
So it's feeding the system with something vital it needs, sort of topping up the tank.
Exactly. And there's another mechanism linked to what happens after it enters the body. It breaks down into other compounds, and one of them, dimethyl sulfone, can inhibit something called NF-key.
NF-key, that sounds complicated.
It's a bit of a technical term, yeah. Nuclear factor cappylite chain enhancer of activated B cells. But you can just think of it as a master switch in your body that turns on inflammation.
Okay, an inflammation switch.
Right. NF-key signals cells to produce inflammatory molecules like interleukin-1, interleukin-6, and tumor necrosis factor alpha. The sources explain that by inhibiting this NF-key switch, this breakdown product of DMSO reduces the production of these pain and inflammation messengers. This is a key mechanism behind its reported anti-inflammatory and pain-relieving effects.
That's a clear explanation. So it works by providing sulfur and by influencing this key inflammation pathway through its breakdown. Speaking of breakdown products, the sources mentioned two specific ones.
Yes, when DMSO gets into cells, it metabolizes fairly quickly into dimethyl sulfide, or DMS, and dimethyl sulfone.
And one of those is responsible for that famous side effect, the garlic breath.
That's DMS. Yep, it's the culprit behind the well-known garlic-like breath or body odor. What's fascinating, according to the source, is that this isn't because DMS chemically smells like garlic,
Oh.
but because it activates special receptors on nerve cells that usually respond to smell stimuli. DMS basically triggers the garlic smell signal to your brain, even if you just put it on your skin.
Wow, so it's almost like it's tricking your body into smelling garlic. That's unexpected.
It is, yeah, the peculiar biological interaction. And the other breakdown product is dimethyl sulfone. This one has a much more recognizable name, methylsulfonylmethane, or MSM,
MSM.
also often referred to simply as organic sulfur.
Ah, so MSM is directly related to DMSO. It's what DMSO breaks down into.
Precisely. MSM is a metabolite of DMSO, and this is a really important insight from the sources. Scientists have suspected for decades, maybe going back to the 1970s, that a significant part of DMSO's internal effect might actually be due to the MSM it turns into. The material suggests the scientific consensus now is largely that when DMSOs is taken internally, it's the MSM component that's primarily driving the desired effects.
Okay, that's the key distinction. So if MSM is the effective part internally, are they basically interchangeable or?
Not quite. While they're related and both occur naturally in many foods like fruits, grains, and vegetables, particularly those high in sulfur MSM supplements provide amounts far exceeding what you'd typically get from your diet.
Right.
And there's a major difference in how you'd use them, which the sources get into.
Before we get to the uses, how does MSM work on its own? Is it the same as DMSO's mechanisms?
The sources indicate it works very similarly in terms of its core actions. It's also primarily a sulfur donor, providing those essential sulfur atoms for antioxidant substances and enzymes, thereby increasing the body's antioxidant potential.
Okay.
The material even mentions this can be measured with specific blood tests, like a TAC test.
And the information piece, does it do the NFK then too?
Yes. Just like DMSO's metabolite, MSM has also been shown to directly inhibit NF-key, that same key inflammatory factor we discussed. So it provides anti-inflammatory and pain-relieving effects through that mechanism as well.
So they share key mechanisms, sulfur donation and inhibiting inflammation via NFT. But if MSM is thought to be the active component internally, how do you decide between using DMSO and MSM? What do the sources say?
The sources suggest the choice really hinges on the intended application specifically, where the issue is located, whether it's localized or more systemic pain or mobility restriction.
And the crucial differentiator they highlight, the main difference.
Tolerance and the method of application. That's the core distinction the material makes when advising on which one might be more appropriate.
All right, let's look at the applications that are supported according to the material you provided. Where do the sources say topical DMSO seems effective?
For localized problems, topical DMSO is described as having good results. This includes issues stemming from blunt trauma and sports injuries, things like bruises, swelling, sprains, strains, and hematomas, applying it directly to the affected area.
Right, to the spot of the injury. Makes sense.
Exactly. The sources also mention localized joint issues like arthrosis or arthritis in specific joints, say the hand or the knee, and also for treating scars.
How is it usually applied?
Typically as gels, creams, or sprays several times a day. The sources give a practical amount, like using a 3 to 5 centimeter strand of gel per application.
Are there situations where higher concentrations are mentioned?
High concentrations, even up to 50%, are mentioned in the sources, but specifically in the context of experimental use for difficult conditions like neuropathic pain or something called morbus Sudeck.
Okay, so not for everyday stuff.
Definitely not presented as a standard recommendation for self-care, no.
What are the critical cautions the sources emphasize for topical use? Anything we really need to flag?
This is extremely important for the material. Application to the eyes or any open wounds like burns or severe sunburn is explicitly stated as something that should only be done under medical guidance.
Right.
The sources say studies for these uses are unclear, and a general recommendation just isn't possible. There's also a note that topical use could possibly increase the risk of pressure ulcers, like bed sores, in bedridden patients.
So clearly not for damaged skin or sensitive areas without professional oversight. You mentioned an anecdote from a pharmacy in the sources about bruises.
Yes, it's a short story about a young man with a large, painful hematoma from martial arts. He went into a pharmacy looking for help with swelling and muscle stiffness.
Okay.
The pharmacist recommended a gel containing DMSO, applied several times daily. The source notes that the hematoma and pain quickly improved, and he ended up, keeping the gel in his home first aid kit. It's a specific example from the source material showing its application for that kind of blunt injury.
That makes the topical application for things like bruises very concrete. Now, shifting gears to oral MSM, where do the sources indicate that is supported?
Oral MSM is highlighted for its excellent tolerance, especially when you compare it to trying to take DMSO orally. Because of this, it's presented as the preferred option for internal use.
Better tolerated.
Much better. It's even classified as generally recognized as safe, or GRAS, by the FDA. The material mentions documented safe dosages up to 4 grams per day.
And what specific uses are supported by these sources?
The primary supported area, based on this material, seems to be joint health. Studies cited suggest it can improve mobility and help relieve pain in joint diseases like arthrosis and arthritis. It's also mentioned in relation to cartilage support and disc problems.
Does it work best on its own, or are combinations common?
It can be taken alone, absolutely, but it's often combined with other popular joint supplements like glucosamine and chondroitin sulfate. The sources note that these combinations may enhance the effect, possibly work synergistically. It's also mentioned for broader use in general pain conditions.
Any other potential benefits the sources listed? Outside of joints and pain?
Yes, they mention potential help with allergic rhinitis, hay fever boosting the body's antioxidant capacity, like we discussed with the sulfur donation, and maybe reducing muscle soreness after exercise.
Interesting. Any tips on taking it?
For joint issues, the sources suggest taking it for at least 3 months to see a clear effect, and they often recommend splitting the dose throughout the day with meals. Helps with absorption and reduces any chance of stomach upset. For exercise soreness, they suggest something like 2 grams, about half an hour before activity might help.
And there was another pharmacy anecdote related to oral MSM and chronic joint pain, right?
Right. This story involved a woman with severe arthrosis pain who was having stomach issues from standard pain medication, like NSAIDs. She'd actually tried pharmaceutical-grade DMSO given by her grandson. Yeah, but reacted poorly with stomach pain, which kind of reinforces why oral DMSO isn't usually recommended. The pharmacist explained the mechanism of action, particularly MSM's role internally, and suggested oral MSM combined with glucosamine sulfate and boswellia extract. That's another one known for anti-inflammatory effects.
A combo approach.
Yeah, and they also suggested a local pain cream. The source notes that after about 2 months, she reported significant pain reduction and easier movement. So it showcases MSM as a potentially better tolerated internal option for chronic joint issues compared to trying oral DMSO.
So we've covered supported uses for topical DMSO and oral MSM based on this material. What about the claims that aren't supported according to these sources? Where do they draw the line?
The material is quite direct on this. They explicitly state that various advertised uses for topical DMSO, things like for local infections, Lyme disease after a tick bite, sclerosis, or dementia. These are not proven by the evidence presented in these sources.
And the big one people often ask about cancer. What do the sources say there?
This is a critical point the sources clarify. They mention that in vitro findings exist, meaning studies treating human tumor cells in a petri dish with DMSO, where they observed an inhibitory effect.
Okay, in the lab.
Exactly, in the lab. However, the sources strongly caution that these laboratory results absolutely cannot be simply extrapolated or transferred to humans. There's a clear lack of clinical studies done on actual people.
Right.
So the efficacy of DMSO, and similarly MSM, for treating cancer, is explicitly stated as not proven by this material. This is a vital distinction between lab results and actual clinical proof in humans.
That clarity from the sources is incredibly important. Let's talk about safety, side effects, and precautions. These compounds are active, so what did the sources highlight here, risk-wise?
For DMSO, taken orally, the sources are very clear. Tolerance is poor. It frequently causes side effects like nausea, vomiting, diarrhea, that kind of thing.
Not pleasant.
No. Yeah. Because of these issues and the fact that its internal effect is believed to be mainly from MSM anyway, the sources strongly advise against the internal use of DMSO. MSM is presented as the much better tolerated internal alternative.
Okay, so oral DMSO is definitely discouraged. What are the common side effects with topical application then, putting it on the skin?
The most frequent issue with topical DMSO seems to be related to histamine release in the skin. This can lead to redness, itching, maybe some tingling, dryness, or a rash where you apply it. Other reported side effects in the sources include things like headaches, dizziness, sometimes chills, and rarely shortness of breath in people who are particularly sensitive.
So if you're sensitive or have allergies, you need to be extra careful.
Absolutely. The sources recommend extreme caution, especially if you're generally sensitive or prone to allergies.
Mm.
They suggest maybe starting with a very small test patch after consulting a doctor or pharmacist. And the risk of local skin reactions increases with higher concentrations, particularly those above 50%.
And it's only for intact skin if you're using it yourself, no cuts or scrapes.
Yes, the sources are unequivocal. Self-medication with topical DMSO should only be on intact skin. Applications to damaged skin, into the eyes, or for any other uses you might see advertised online are not supported for self-use and really require medical supervision because the data just isn't there to recommend it generally.
Clear guidelines there. What about MSM safety and side effects? It sounds much better tolerated overall.
Yeah, MSM is generally presented as very well tolerated in the sources, especially when taken alongside meals. Those side effects we just talked about with oral DMSO, like significant nausea or diarrhea, are not typically associated with MSM. As we mentioned, it's classified as GRAS up to 4 grams per day.
Any potential side effects at all, though, even mild ones?
The possible side effects mentioned are primarily related to the digestive system, maybe some gas or stomach discomfort. But these are usually described as temporary and tend to be more common when you first start taking it. Usually settles down.
And what about specific populations, like during pregnancy or breastfeeding? Any advice there?
The sources recommend discussing the use of MSM during pregnancy or breastfeeding with a doctor, which is pretty standard advice for most supplements, really. Always best to check.
Let's look at how these compounds are regulated and sold. The sources note this can be a bit complex, maybe even confusing.
It is, yeah. The sources differentiate between what are considered drugs, Arzneimittel in German, mentioned in one source, medical devices, Medizinprodukte, and dietary supplements, Nahrungsergänzungsmittel. Essentially products defined by their primary mechanism of action and how they're regulated.
And DMSO fits where?
Well, DMSO can actually fall into all 3 categories depending on the specific product and country. For example, the sources mention it's a registered prescription drug in the U.S. for a specific bladder condition, interstitial cystitis.
Okay.
Though they do note comparisons in the material suggest other treatments might actually be preferred for that now.
So it can be a prescription drug, but also something you might buy over the counter.
Right. Topical products containing DMSO, like gels or sprays for pain, are often registered as over-the-counter medicines or medical devices in various countries. But then you can also simply buy high-purity DMSO as a chemical solvent.
And MSM status is simpler.
Generally, yes. MSM is usually regulated and sold as a dietary supplement.
The sources mention a legal gray area, particularly concerning buying pure DMSO online. What's that about?
Yeah, this highlights a bit of a regulatory loophole. Sellers of pure, often 99.9% DMSO solutions online, are very careful with their labeling and descriptions. They try to avoid making medical claims that would classify their product as a drug.
How do they do that?
The sources note they might label it simply as an organic solvent with varied properties, without specifying any medical use or dosage. That phrasing is technically legal because it doesn't instruct you on how to use it medically, so it stays out of drug regulation territory.
Sneaky. So if someone was considering buying pure DMSO based on this information, what guidance do the sources offer on what to look for to be safe?
The material advises looking for pharmaceutical-grade quality, ideally in a brown glass bottle, stressing it should be tested for impurities. Storage in the fridge is recommended. It crystallizes when it gets cold, but you can gently warm it to reliquefy without damaging it.
Okay.
The sources also mention it can develop a stronger sulfur smell over time as it breaks down into DMS, and if that happens, it's probably best to use it up quickly. And crucially, the sources note that pure DMSO is typically diluted before use up to a maximum of 50% for topical application.
And oral.
Well, while dilution for potential oral use is sometimes mentioned online, like half a teaspoon in water, the sources strongly reiterate their advice against internal DMSO use altogether, really pushing MSM as the better option due to tolerance issues.
This brings us to some of the broader criticism and the data gaps surrounding DMSO, which the sources acknowledge. It sounds like there's some controversy.
Yes, the material points out that dimethyl sulfoxide has faced criticism for years in the medical community. You've got very vocal proponents claiming wide-ranging benefits, almost miracle cure stuff, and equally strong skeptics raising concerns about the lack of rigorous evidence and potential dangers. The sources suggest the truth is likely somewhere in between these extremes, but it's difficult to definitively prove. due to a significant lack of expensive, high-quality clinical studies.
So a data problem, particularly for certain applications.
Exactly. According to the sources, the data is significantly lacking for internal use, which is why they fundamentally recommend against it. For external topical use, the data is described as uneven, meaning studies aren't always consistent or maybe not the best quality.
But they don't dismiss it entirely.
No, the sources seem to conclude that short-term, proper topical use on intact skin is generally considered low risk, and that the observed effectiveness in practice for specific indications like those blunt injuries we talked about kind of justifies this approach, even if we don't have perfect, large-scale comparison studies for everything.
Is this lack of studies unique to DMSO, or is that common?
The sources are quick to point out that this lack of rigorous, expensive clinical trials is also true for many widely used herbal preparations, so it's not an issue confined solely to DMSO.
Fair point. And despite this debate and data gap, it remains widely available.
Yes, as of 2020, when this source was compiled, it had been available for many years without major bans from entities like the EU regarding sale or shipment to individuals. Although the source does suggest that maybe more uniform legal regulation for purchasing would improve clarity for consumers.
Okay, wrapping up our look at the specific uses, based only on the sources you provided, how do they summarize the recommended uses for the listener? What's the bottom line?
Okay, based on this material, the internal use of DMSO is not recommended. Pretty clear on that. Primarily due to unproven effectiveness and poor tolerance.
And for topical DMSO, putting it on the skin.
Topical application of products containing DMSO, like gels or creams, may be used, but it's for short-term, proper application on intact skin only, to help with things like swelling and pain from blunt injuries or maybe inflammatory joint changes.
But not for.
Crucially, not recommended for use on damaged skin. Definitely not in the eyes or for any other uses advertised elsewhere that lack support in this material. Stick to the basics.
And finally, oral MSM.
Oral MSM is presented as having good tolerance and being suitable for longer-term use, like 3 months or more, for chronic issues. It's suggested as potentially useful for joint diseases, general pain relief, muscle soreness after exercise, and maybe even allergic rhinitis.
But to put all of this into broader context, the sources connect these compounds to the listener's potential needs, right? Everyday life.
Right. With an aging population experiencing more joint and mobility issues and, increasing interest in fitness leading to more sports injuries, managing pain is a common concern for a lot of people.
Sure is.
The sources position topical DMSO and oral MSM as potential tools in the toolbox, maybe alternatives or additions to conventional pain relievers.
But with that critical caveat, always the but.
Always. The sources stress that any use should always be in consultation with a doctor or qualified practitioner. Don't just self-diagnose and treat based on something you read online. And a very important point they make is that neither of these substances addresses the underlying cause of chronic conditions.
That's a vital distinction. They might help symptoms, maybe mask them a bit, but they aren't fixing the root problem.
Exactly. And building on that, the sources conclude that for chronic issues, relying on just one single substance probably isn't the answer. They emphasize the need for a more holistic concept, something involving many integrated, interlocking measures to manage long-term health challenges effectively.
We've really gone through the stack of sources you shared, covering what DMSO and MSM are, how the material says they work, where the evidence in these sources supports their use, and importantly, where it clearly states it doesn't. Plus safety, buying tips.
Yeah, I think the main points to take away are that they are related compounds, but with different preferred applications based on this info. Topical for certain localized injuries or pain with DMSO.
On intact skin.
On intact skin, yes.
Yeah.
Internal oral use for broader issues like joint health or general pain relief with MSM, which is much better tolerated. Neither is presented as some kind of magic bullet, and proper use, along with medical consultation, are really essential according to this material.
And that final thought from the sources really resonates for chronic issues. It's not just about finding one substance to fix everything. It's about a whole approach. It makes you think, when managing long-term health or pain, what would a holistic concept with many interlocking measures actually look like? And how might substances like these fit within such a broader plan rather than being the whole plan themselves?
It definitely poses an interesting question for anyone navigating complex health challenges. How do all the pieces fit together?
Definitely something to consider. Thanks for letting us dive into this material with you today.